Every 40 seconds, someone in the United States has a heart attack. Imagine that. Heart attacks are one of the leading causes of death worldwide, and they can happen to anyone at any time. But what really happens during a heart attack? In this content, we're going to explain what a heart attack is, what the signs are, and how you can protect yourself. Plus, we'll share Mary's story, a true experience that shows just how important it is to recognize the signs of a heart attack and act quickly. What is a heart attack? A heart attack happens when blood flow to a part of the heart gets blocked. The heart needs a constant supply of oxygen-rich blood to keep working. If this blood flow is blocked for too long, the heart muscle starts to die. This blockage usually happens because of a buildup of fatty deposits, cholesterol, and other substances in the coronary arteries, which are the blood vessels that supply the heart. When these deposits form a plaque, it can rupture and cause a blood clot to form. If the clot is big enough, it can completely block blood flow, leading to a heart attack. Why it's important to know about heart attacks. Heart attacks often seem to come out of nowhere, which is why they can be so dangerous. However, the truth is that most heart attacks are the result of heart problems that build up over time. The suddenness comes from the fact that the final blockage can happen at any moment. Knowing about heart attacks is really important because many people don't realize they're having one until it's too late. Sometimes people think the signs of a heart attack are just something minor, like indigestion or stress. But knowing what to watch for and what to do can save lives. Challenges during a heart attack. One of the biggest problems during a heart attack is that people often don't know it's happening. Not every heart attack feels the same. Some people might have a lot of pain, while others might feel only mild discomfort. Misconception. Heart attacks always cause severe chest pain. Many people think that a heart attack always causes strong chest pain, but that's not true for everyone. Some people, especially women, might have different symptoms like shortness of breath, nausea, or pain in the back or jaw. Because these symptoms are different, they might not realize they're having a heart attack and delay getting help. Misconception. Heart attacks only happen to the elderly. While older people are more likely to have heart attacks, they can happen to younger people too. If you have a family history of heart disease, high cholesterol, or if you have unhealthy habits, your risk is higher even if you're younger. Misconception. You can tough it out. Some people think they can just wait and see if the symptoms go away. But during a heart attack, every minute counts. The longer your heart doesn't get enough oxygen, the more damage happens. That's why it's important to get medical help right away. Signs of a heart attack. Knowing the signs of a heart attack can help you act quickly. The most common symptom is chest pain, but there are other signs to watch for. Chest discomfort. This can feel like pressure, squeezing, fullness, or pain in the center of your chest. It might last for a few minutes or go away and come back. Discomfort in other parts of the upper body. You might feel pain or discomfort in your arms, back, neck, jaw, or stomach. Sometimes people mistake this pain for something else, like a pulled muscle. Shortness of breath. You might feel like you can't catch your breath, even when you're not doing anything active. Cold sweat, nausea, or lightheadedness. These symptoms can be mistaken for less serious problems like the flu or stress, but they can also be signs of a heart attack. Who is at risk for a heart attack? Some things can increase your chances of having a heart attack. While you can't change some of these factors, you can control others by making healthier choices. Age. The risk of heart disease goes up as you get older, especially for men over 45 and women over 55. Family history. If your family members have had heart disease, especially at a young age, you're more likely to have it too. High blood pressure and high cholesterol. Both of these conditions can damage your arteries, making them more likely to get blocked. Smoking. Smoking damages the arteries and makes it easier for plaque to build up, which can lead to a heart attack. Diabetes. Diabetes increases your risk because high blood sugar levels can damage your blood vessels. Obesity. Carrying extra weight puts more strain on your heart and can lead to high blood pressure, high cholesterol, and diabetes. Physical inactivity. Not getting enough exercise increases your risk of heart disease. Regular exercise helps keep your heart strong and healthy. Unhealthy diet. Eating too much saturated fat, trans fat, and cholesterol can cause plaque to build up in your arteries. Stress. Chronic stress can damage your arteries and make other risk factors worse. Alcohol consumption. Drinking too much alcohol can raise your blood pressure and increase your risk of heart failure. What happens during a heart attack? When you have a heart attack, your body goes through a series of changes very quickly. Here's what happens. Plaque rupture and blood clot formation. A heart attack often starts when a plaque in one of your coronary arteries ruptures. Your body tries to repair the damage by forming a blood clot, but in the narrow artery, this clot can block blood flow. Oxygen deprivation. Without blood flow, the part of your heart muscle that's supplied by the blocked artery doesn't get the oxygen it needs. This is called ischemia. Cell death. If blood flow isn't restored quickly, the lack of oxygen causes heart muscle cells to die. This can cause permanent damage to your heart. Electrical instability. The damage to your heart muscle can mess up the electrical signals that control your heartbeat, which can lead to life-threatening irregular heartbeats or arrhythmias. Heart failure. In severe cases, a heart attack can damage so much of the heart muscle that your heart can't pump blood effectively. This is called heart failure. Mary's journey, a real-life story of survival. To really understand how serious a heart attack can be, let's look at the story of Mary, a 58-year-old mother of two. Mary was a healthy woman who exercised regularly and ate well. One day, while she was out for a walk, she felt a strange pain in her chest. At first, she thought it was just indigestion, but the pain didn't go away. As the pain spread to her back and jaw, Mary started to feel short of breath and lightheaded. She knew something was wrong, so she sat down and called 911. When the paramedics arrived, they gave her aspirin to help prevent further clotting and rushed her to the hospital. At the hospital, doctors found that Mary was having a heart attack. They quickly performed a procedure called angioplasty, where they used a small balloon to open the blocked artery and placed a stent to keep it open. Because Mary acted quickly and got help right away, her life was saved. Mary had to go through cardiac rehabilitation and make some changes to her lifestyle to lower her risk of having another heart attack. Now, she talks to other people about the importance of knowing the signs of a heart attack and getting help fast. Mary's story shows just how important it is to recognize the signs of a heart attack and to act quickly. By knowing what to do, you can save your own life or the life of someone you care about. What you can learn from this. Mary's experience teaches us some important lessons about heart attacks. Know the symptoms. Chest pain is a common sign, but not the only one. Be aware of other symptoms like shortness of breath, pain in the back or jaw, and cold sweats. Remember, symptoms can be different for everyone. Act quickly. If you think you might be having a heart attack, call 911 right away. The faster you get medical help, the better your chances of surviving and avoiding serious damage to your heart. Take care of your heart. You can reduce your risk of a heart attack by managing your blood pressure, cholesterol, and blood sugar levels. Eat a healthy diet, exercise regularly, avoid smoking, and drink alcohol only in moderation. Stay informed. Learn about your risk factors and stay informed about heart health. The more you know, the better prepared you'll be to protect yourself. Help others. If you or someone you know has had a heart attack, share your story and encourage others to learn more about heart health. Your experience could make a big difference. If you found this content helpful, make sure to subscribe to our channel and leave a comment with your thoughts or experiences with heart health. Your feedback is valuable, and we love hearing from our viewers. Stay tuned for more content on how to keep your heart healthy and live a longer, happier life. A heart attack is a serious event that needs immediate action. By knowing the signs, understanding the risks, and acting fast, you can protect yourself and your loved ones. Every second counts during a heart attack, so don't hesitate to get help if you think you're experiencing one. Until the next one, stay informed, stay active, and most importantly, stay healthy.